Hi, welcome to my YouTube channel. And haven't been too active in the past few months, but I promise to be more active in the future. Now, today is a very special episode for me because this is something which is very close to my heart, where I believe in giving complete justice to skin as an organ. So, human body is actually one unit, right? And we have different organs which make one healthy human body. So, you can never have your heart working completely fine and your lungs not working fine. If one organ is not working fine, the effect finally comes on you as a complete human body. Now, why do we alienate skin so much? Like I have mentioned in the past, that skin is the largest organ of your body, which has its own blood supply, nerve supply, lymphatic drainage, and an extremely important another element, and that is your hormones. I completely believe that nothing affects the skin more than your hormones do. So it is the hormones which make your skin look good. It is also the hormones which make your skin bad. Haven't you all had this thing where you wake up one day and you feel, oh, today I'm looking nice? It's not that you've applied a special night cream. And some days you wake up and you say, I'm not looking so good. Maybe you have applied a brilliant 100-pound night cream. So, what is that one factor which is getting these changes in the way your skin appears? Trust me, it is your hormones. And today I have someone very special, a very good friend of mine, and a very beautiful friend of mine, one of the leading gynecologists we have in Mumbai, Dr. Drupti Dedia. And you can see she's radiant and with a beautiful skin. So I think we share the same views that where your hormones are concerned, your skin is answerable. And we shall today, there are a lot of stages in your life where hormones matter, like in puberty because of acne. The young children are bothered with acne, pigmentation. Also in the third decade of life, you see sometimes we have people, girls in their 30s, who come up with not so bright skin. Of course, we have that phase of pregnancy and postpartum, and then we also have a premenopausal phase. Today, we will concentrate on puberty and the changes that hormones get on your skin when you're young. So, Trupti, I have this question for you. I have these young girls who come to me all the time with acne. The skin is not so good. There are comedones, that is whiteheads, blackheads everywhere. And plus, I personally believe that the skin doesn't have that natural moisture and shine which it should have if you are young. So, what kind of hormones are we dealing with here?
So the effect of there are two hormones that come up in the body when you start getting your period is estrogen and progesterone. The effect of progesterone on every individual is different. Estrogen is the one which makes our skin look soft and nice and radiant, but the progesterone is a secretory hormone and it causes the pimples to come, the acne to come. So a lot of girls will complain about a pimple coming up. They know that their period is coming because a pimple comes up. And there are a lot of girls who have a lot of acne and the skin just breakouts and leaves scars. So it is the same hormone. It is a natural hormone that is produced in every person, but the effect is different. And that is why, they require help.
Right. So, can I safely say that these hormones need to be balanced for a complete skincare routine? Like, for example, I have girls who will come and their parents say that, doctor, we do not want to take any medication, but the skin is completely troubled. I can see that. Of course, I will start with them trying a natural way, like maybe we ask them to work out regularly because when you exercise, you produce endorphins, which itself also helps the skin. We ask them to be careful about their diet. We make them drink a lot of water. But sometimes we need help, don't we?
Yeah, we do. And when you talk about natural treatments, it is difficult for some children to follow the natural path. Yes. That is one category which requires help. And the second category where the pimples are so severe that they leave bad scars, which reduces, changes their personality. They get depressed, they don't feel confident. So taking pills is considered as a very bad thing, especially at this age.
Yes,
Mothers are
yes.
so worried, and here usually you have a single patient and you have to just deal with that patient, explaining things to her. When you have the full family coming, the
Yes.
parents coming, and to convince them to take a pill which is a hormone, most of them are associated with, having problems in future. Will she have a problem in childbearing?
Yeah,
So
yeah,
that
that's a
is
very common question.
yeah, but it's a big myth. Okay. So usually if you will be able to put on more light, these pimples come in a particular age group. So it's not that they have to take the medicine forever. they have to take it for a short time. And there are problems that come along with the hormones when I'm giving them orally. So we talk about the side effects. And if there is a particular side effect, we change the dose. Okay. There are pills which are available with different levels of hormone, and the progesterone can be changed depending upon the side effects they have. So one is counseling them and then telling them,
Right.
what is to
So
be done.
it's like the so-called the elephant in the room, which people talk about, like polycystic ovaries. And today, so many girls are dealing with that. And like what I see clinically are the weight gain, the pigmentation, the uneven texture of the skin, the acne. A lot of them also are associated with body odor, I have seen, and which kind of keeps their friends away from them. They're conscious about them. So somewhere the peer pressure increases, and I think it becomes like a cycle because they get more stressed and the acne increases. So I think that is a time when we need to get on, get to know a gynecologist or meet a gynecologist. And I
Or
think
it's the other way around. If they come to me for irregular periods with a very bad skin, there is only so much I can do, that I can correct the hormones so that the number of pimples she gets will be less. But local treatment is important. What vitamins to take, how to take care of the skin is also as equally important as that.
Yeah. So clearly we need to have a tandem where we have the hormones controlled along with the skin. So it is something where the two specialities of medicine work hand in hand. And we have Dr. Drupti on our dial list. So if we have young girls who we are unable to handle with topical treatment, we need her on board. So this episode is to just bring across a point that at some point we will need to govern the hormones. We do try to keep it as natural as we can, but there is no harm in trying and getting intervened with medication if they're safe.
And also I would like to say that there's a spectrum of polycystic ovaries. There are people who have just borderline disease, which can be controlled with natural treatment, taking care of the skin, and things improve. But there are people where the spectrum, they are at the other end of the spectrum, where if the medicine is not given, it is very, very, very difficult to control. So there's a lot of literature on this. There's so much available on YouTube today, or people Google it up and they have all the knowledge. But to convince them to take the pill is something which helps us in treating the patient.
So I would like to sign off with this, this one episode where we've been able to bring about the relationship between hormones and skin by some tips which you could do naturally at home. One is, see to it that your child is physically active. I understand teenagers have a very, very stressful life. Their school timings and college timings are absolutely a killer. They have a lot of stress. But please get 20 minutes or 30 minutes of a physically active time in your child's life. See to it that they're drinking a lot of water. Try to be a little bit empathetic towards them, and see to, because they are dealing with so much friend pressure here, there. So maybe you could help relieving that stress. Maybe I do give a little bit of vitamin E to counter the mood changes, because that itself can increase the acne. I think vitamin D3, Drupti could help us.
So vitamin D3 is associated with polycystic ovaries. So 80% of the Indians, it is said that they have a deficiency in vitamin D. So if we correct the vitamin D, it's a little easier for us to correct the PCOS.
And there is also some hair fall which is associated with polycystic ovaries. And I have seen girls coming with complaining with their hair dropping, and to see
hair growth on the face, the
hair growth on the face, hirsutism. So we do advise them to go in for a laser hair reduction over threading and over waxing on the face, because that itself will cause more acne. But along with that, getting the hormones stable is going to be paramount in having a permanent result.
And what I have really noticed is there are a lot of centers today who do laser treatments for hirsutism, but without correcting your hormones.
Yes.
So if your testosterone levels are high, you are going to end up with more hair, even if you keep on removing them. So it is very important to correct it first, and then go on, so that your laser treatment also
and we have these commercial centers which give you a lifelong package of laser. How weird is that? I mean, a lifelong package of laser, you might as well go and thread lifelong if you need to be doing the laser lifelong. So there has to be a stipulated time where the laser has to end, and that is possible only when your hormones are stable. So the takeaway point is, do not consider these two things as unrelated. They both are related. So maybe start your child with a vitamin E low dose. If you feel they're going through mood changes, get the vitamin D3 levels corrected, let them work out. And yes, if that is not helping, visit your dermatologist or your gynecologist, whomever you want to visit first, because finally we are going to be there together. So stay tuned for our next episode, and we'll be back sooner than last time.